Welcome to another episode of Roots and Horizons, where we stay grounded in our heritage while growing toward new possibilities. My name is Dr. Errol Elad, and today we're tackling an important issue within Filipino-American families, the generational differences in understanding addiction. In many families, addiction is viewed differently depending on your age or life experiences. Older generations might see it through a very different lens than younger ones, and this can create significant challenges for both those struggling with addiction and their families. How do older and younger generations perceive addiction, and how can we bridge this gap to create a more supportive environment for recovery? Let's dive in. For many in the older generations, addiction is often seen through the lens of morality, discipline, or even family honor. Growing up in a culture that emphasizes strength, resilience, and respect, addiction may be viewed as a personal failure rather than a medical condition. It's not uncommon to hear phrases like, "Kung gusto mo, kaya mo," if you want to, you can do it, which suggests that overcoming addiction is simply a matter of willpower. This viewpoint is rooted deeply in Filipino values like hiya or shame, bayanihan or community support, and personal responsibility. For some, the idea of being labeled as addicted can carry a stigma, making it hard for individuals to openly address their struggles, especially when it comes to mental health or substance use. In this cultural context, addiction is often perceived not as an issue to seek outside help for, but as something that should be dealt with privately or in isolation. As we move into newer generations, particularly those who have been exposed to Western education and healthcare systems, we see a shift in how addiction is understood. Younger Filipinos are more likely to view addiction through the lens of science, recognizing it as a chronic disease or mental health issue that requires professional treatment. The medical community has made great strides in explaining how addiction is not simply about willpower, but about the way substances can alter brain chemistry, making it extremely difficult to quit without the right treatment, support, and intervention. The stigma attached to addiction is still present, but there is a growing awareness that addiction doesn't discriminate and is far more complex than just a moral failing. It's a combination of biological, psychological, and social factors that can affect anyone, regardless of their background, and overcoming it often requires more than just self-discipline. It requires comprehensive care, patience, and understanding. When there is a gap in how addiction is viewed between generations, it can create significant barriers to recovery. A person struggling with addiction may hesitate to ask for help if they fear being judged, shamed, or dismissed by older family members. This reluctance to seek help can lead to isolation, prolonged suffering, and a lack of support during a crucial time. The shame attached to addiction can be even more pronounced in Filipino culture, where family honor and reputation are deeply important. A young person struggling with substance use may feel they are failing not only themselves, but also their family and community. In turn, this can perpetuate the cycle of addiction, as the individual may continue to hide their struggles, unable to access the support they need. The lack of open dialogue between generations creates a wall of silence around addiction, making it harder for families to heal together and for individuals to recover. So, how do we begin to bridge this generational gap in understanding addiction? One of the most important steps is education. Families need to be informed about the science of addiction, and it's important to emphasize that it's not a sign of weakness, but a complex condition that requires treatment and understanding. This can help older generations understand that addiction is not something that can simply be overcome with discipline alone. Additionally, having open, honest, and respectful conversations between generations can help build empathy. Instead of immediately dismissing someone's struggle with addiction or labeling them as weak, try asking questions like, "What makes you feel this way?" or "How can we support you?" This simple act of listening without judgment can make a huge difference. It shows that you care, and it encourages younger generations to open up. Moreover, Actively fostering intergenerational dialogue can help break down the barriers of shame and misunderstanding that often surround addiction in Filipino families. It is through this dialogue that empathy can grow, and the family as a whole can learn to support one another. While the generational divide can make it difficult to discuss addiction within families, we must also acknowledge the importance of community support in the healing process. Filipino communities are often tightly knit, and for many, bayanihan, the spirit of communal unity and helping one another, is at the heart of family life. However, addiction can sometimes isolate individuals, leaving them feeling disconnected from their loved ones. For recovery to truly begin, the family, along with the broader community, must be willing to create an inclusive environment where individuals feel safe to open up about their struggles. This includes reaching out to support groups, seeking therapy together, or even turning to spiritual guidance. In Filipino culture, many individuals turn to their faith for strength, and faith-based communities can provide a foundation for healing as well. The healing journey is not just about the individual, it's about the collective strength of the family and community, supporting one another through the toughest times. As we bridge generational gaps, let's also remember that recovery is a shared experience, and together we can create a more understanding, compassionate environment for those seeking help. Addiction isn't just an individual struggle, it's a family and community issue. It's not something one person should carry alone. If we want to create real change in how addiction is understood and addressed, we need to start by talking and listening to one another. Bridging the generational gap within our Filipino-American families will not only help those struggling with addiction, but also create a culture of support, empathy, and healing. Let's work together to eliminate the stigma, break the silence, and foster a more compassionate approach to addiction and recovery. This is how we build stronger families, stronger communities, and healthier generations moving forward. Thank you for tuning in to this episode of Roots and Horizons. If this conversation resonated with you, please share it with your family and loved ones. Let's continue breaking the stigma together. Until next time, stay grounded, stay open, and keep growing.